everybody. Dr. Peter Glidden here, your steadfast advocate for health, reminding you that doctor means teacher. If you look up the literal Latin translation of doctor, where the word originated, docere, it means teacher. When was the last time your medical doctor ever taught you anything? Inquiring minds want to know. I made a promise yesterday, and I'm like to keep my promises as best as I can. Why? Because I said so. Asked Maria to call me back, and I would pick her up very first thing. Here she is, all the way from California. Let's welcome her back to the show. Maria, thanks so much for calling back. You are live.
Thank you, Dr. Glidden, and thank you for inviting me to call back, because we do have quite a bit of things still hanging.
Okay, so let's go. So now remember, this is a new show, and we have a brand new listening audience. So you want help with your father, who has amyotrophic lateral sclerosis. He's basically bedridden, and he's on a feeding tube. Is that correct?
Yes, and he's trached, so he has been dependent for 9 years.
Okay.
And he was hospitalized in June with urinary tract infection and pneumonia.
Yeah.
He was sent home on Levaquin for that. He had hyponatremia of 116, went home with 142. He had a pleural effusion, had a pneumothorax, had a chest tube, went home with it sealed. He had hypothyroidism, and so he went home on Synthroid, and Lasix, and Reglan, and KCL.
Well, that's interesting, because Lasix, one of the side effects of Lasix is hyponatremia, right? That's one of the side effects of Lasix, right?
Right. So we all know that the medication will fix one thing and totally upset the other thing, right?
Right.
Well, he actually perked up. It took them a while, but they told me to take him home so he could die at home. So he did come home, and we were getting ready emotionally for his leaving us, and yet he perked up, and he got to his norm. In early September, I heard about longevity, and I decided that even though my dad's ALS has been like for 10 or 12 years, and he's totally at the end stage, I decided that if anything was going to pick him up, it would probably be longevity. And who am I to deny him that chance? So I ordered the products, and he was on them through the gastrostomy tube. So, of course, the first question that arises is, can all these be given crushed or separated out from their capsule, from the gel capsules? Am I still getting benefit and value?
Oh, yes, anyway, absolutely. Absolutely, positively, yes.
I figured so, except for the bilayer capsule, Immortalium.
That's trickier. When you crush that up, you kind of eliminate the bilayer digestive process, but that's relatively irrelevant at this stage of the game.
Right. Well, it was in one of the list of suggested things for ALS. So instead of that, I gave him Cell Shield.
Smart girl.
Well, anyway, so he perks up. He starts on the protocol, and I think he's having some kind of a reaction to it. I think so. I don't want to hallucinate or imagine hope giving me false things, but I think he started moving his pinky. Yeah. And it seems to me that instead of his eye gaze, his eyesight deviating to the corners, he seems to central his eye gaze more centrally, you know. But he doesn't focus. He doesn't seem to be really looking at me, and he doesn't necessarily respond to me at all. But he seems to be having a bit more of a normal reaction. So I'm hoping that it's like baby steps in the right direction.
Right.
But then what happened last Sunday, 10 days ago? I woke up, he was already awake, but he didn't look good. He looked like he was in distress. And, you could tell after 9 years of taking care of him. So I took his temperature. It was 101.4. Nothing showed me signs of infection. I didn't give him Tylenol. I thought, let me write it out. I'll give him nice pat downs of wet washcloth. He diaphoresed horribly, and he looked okay for another couple of hours. But anyway, let me hopefully make the story shorter. He ends up having his urine started to change colors. It got very dark amber. It got brown almost, and I think he's spilling blood into his urine. And then his fever just started going wacko for 3 days, up and down, up and down. The visiting nurse came over, took some lab values, got the UA. It was bloody. It had 3+ blood, 3+ protein. 2+ protein. It had sediment, obviously. I thought that the powders, the Beyond Tangerine, was actually in the Foley bag. It looked like it. And the cytology report, they sent it out for tumor checks, and it was negative for any type of that. And a CAT scan in June also had negative for CA or any process that way. His WBC this time around, last week, interestingly enough, was 8.8. with no shift to the left. But they tell me he has a UTI, so they put him on Levaquin.
Yeah.
The doctor comes into the scenario and decides he wants to make it more broad spectrum, so he puts him on Citromax also.
Did they take him off of the Levaquin, or did they keep him on both?
Simultaneously.
Yeah, that's a bad idea. Okay.
The chest X-ray, which was done in the home setting, had a moderate-sized pleural effusion loculated. And he also, as I told you, he's hyponatremic. Right now he's at 124. His potassium is 3.3. His BUN had gone up to 22 4 weeks ago. To 30. Now it's 22. But my questions, I stopped the longevity. I thought, I'm not sure that longevity is too potent for him. I'm not sure if he's picking it up or if it's going right through his GI tract.
Yeah.
I started to give him, I called the show on Friday. Unbeknownst to me, you were not there, but I called and I spoke with a person named Mike. And he told me, and he heard a lot of the story already, and he said, it's a little bit out of my realm here. Call back on Monday and talk to the doctor himself. Yeah. But for the meantime, he said, why don't you start your dad on plant-derived minerals?
Smartest man in Canada right there. Okay, good.
So I started him on that because I did have some plant-derived minerals in the house. So I started giving him that, and out of the 32-ounce bottle, I probably have given him 20 ounces up to this point. So I also was starting giving him more and more eggs. I had him up to about 8-9 eggs a day. And I wondered if the eggs, the longevity, something was not quite hitting him safely. So I also stopped the eggs because in addition to the hematuria, I started having signs of petechiae, spider veins, where normally I wouldn't see them.
Yeah.
So I thought his clotting factor seemed to be off whack. And I'm not sure if that's coincidental, if it is an infection-induced thing.
Well, that's not a clotting factor problem. Normally that's a problem with a lack of copper, and the veins in his body are becoming fragile because they need copper. They need the mineral copper in order to maintain their elasticity, and copper, of course, being a mineral, is one of the first things to leave the body, and it's very easy for people's bodies to become minerally deficient as opposed to vitamin deficient. And whenever a mineral deficiency is in play, you're going to get strong and persistent symptoms specific to that one. So I would be pretty much sure that was caused by a copper deficiency. So, Maria, in the interest of time, right, 3 minutes left here.
Okay.
What specifically do you need advice and help with?
Well, is it advisable for him to get back on the longevity? At what pace do I do it? How do I start with which products? And what would be a plan of action to pursue, with steps to take?
Really great questions. Okay, so first things that we need to consider, and it's a point well taken, that you were probably right. I mean, you're one of the most observant people that I've spoken to in a long time, and after 25 years of work in the trenches, right, of clinical work, you get a sense for people. So undoubtedly
just
what
add
you
that
saw in
me
the
just
Foley
add-
bag was the Beyond Tangy Tangerine. And given that observation, the only possibility there is that his intestinal tract has been compromised by decades of wheat, barley, rye, and oat consumption, that it's difficult for him to absorb anything. And now, when we disrupt the digestive process with intubation, and we're giving him parenteral nutrition through a feeding tube, just the presence of the feeding tube is going to upset the apple cart, because the digestive process is like a series of dominoes, which knocks the other over. And you remove a couple of those, or you throw a wrench into those gears, he's going to have a problem absorbing and digesting anything just because of the presence of the tube in his body. But notwithstanding that, right, our whole foundation, kind of observational foundation here, is that the reason that all of these things happen in the first place, the reason that people get amyotrophic lateral sclerosis, the reason that people get congestive heart failure, the reason that people get kidney failure, the reason that people get high blood pressure, is because of nutrient deficiencies. It's nutrient deficiencies. It's not genetic. It's not the stress of life. It's nutrient deficiencies, period. Well, what accelerates nutrient deficiencies? Consistent consumption of wheat, barley, rye, and oats, and, foods that are just bad for the human body. And then eventually those chickens come home to roost, and now we're symptomatic. And once we're symptomatic, it's a downhill slide. So what we need to do here is dial in a strategy which will optimize the chances and the ability of his body to be able to absorb the stuff that he so desperately needs. And there are ways to do that. There are workarounds for that. The problem here isn't the nutritional supplement with Youngevity. The problem is the way in which it was delivered to a very weak and stressed out system. So you hang out with me, Maria. I'll dial this in for you when we come back. This is how we do it, folks. We're talking to Maria from California about her father, who's struggling along here with amyotrophic lateral sclerosis, bedridden on a feeding tube, and we're trying to just figure out what we can do to help. So, Maria, the first thing to do here is to get the plant-derived minerals into his body on a regular basis. And how many times a day do you actually put food in the feeding tube for your dad?
My dad eats 3 times a day, and it's homemade food. It's not canned stuff.
Okay, so your father needs to be avoiding the 10 bad foods, right?
And he has, obviously.
Okay, all right, great. So, and you need to be concentrating on cholesterol donors, and give him some salt, and don't be afraid of salt, especially if he's been hyponatremic in the past, which would be caused by Lasix. It's interesting that they use Lasix to prevent a condition called dropsy, which is, his feet will swell up, or his ankles will swell up, or his abdomen swells up because his body's not clearing. It's kind of a reverse osmotic gradient has been set up in the bloodstream. And instead of...
I think they placed him on Lasix because it first happened after the pleural effusion was noted back in June.
Yeah, it's interesting, right? I'm not even sure that he needs to be on that anymore, but it's not my place to micromanage his prescriptions.
I didn't give it to him.
All right, smart girl.
I came home and I stopped that.
All right, now that makes you my favorite person in California. All right, so here's what we need to do moving forward. All right, so I would administer unto his body 1 ounce of the plant-derived minerals 3 times a day, 1 ounce of the plant-derived minerals 3 times a day. However, I would give it to him between meals, if you can do that. I would give it to him between feedings. 1 ounce of... Can you do that?
Yes, I can. In fact, can I do it with the selenium?
Yes, so I'm getting there. Okay, yeah, so we want to try to give him the mineral supplementation between meals as much as is possible, but we have to do it in a way that's not going to upset the apple cart, right? So... Okay. 1 ounce of the plant-derived minerals, and I'm going to say 2 or 3 ounces of water 3 times a day between meals. 3 times a day between meals.
Okay.
To that cocktail, you can add 1 ounce. Actually, in his case, I would give him a half an ounce of the Beyond Osteo FX, 1/2 ounce of the Beyond Osteo FX liquid 3 times a day, in with the plant minerals in the water. 1/2 ounce of the Beyond Osteo FX liquid in with the 1 ounce of the plant minerals and a couple of ounces of water. Additionally, you can give him 3, 6. How much does he weigh?
122.
Okay, let's give him 9 selenium. So let's give him 8 selenium. Let's give him 4 capsules of selenium twice a day in with the cocktail, and you can just open the capsules up and dump the powder into the cocktail.
Right. Okay.
Now, be advised, that selenium powder on contact with water will turn bright purple. And
I've already know that.
It's supposed to. Okay. All right.
Yeah.
So 4 of those twice a day with the calcium and with the plant minerals. And that's a really good place to start. I'd like you please to give him 4 EFA plus every time he eats. 4 EFA plus 3 times a day with food. But I want you to pierce the EFA plus capsule with a needle, squeeze the oil out into the food that you give him, and put that into the feeding tube. So 4 of the EFA plus capsules 3 times a day with food. 4 of the EFA plus 3 times a day with food. You can also pulverize the Immortalium at the same time, or if you have the Cell Shield RTQ, you can open up the capsules and give him 2 of the Cell Shield RTQ 3 times a day with food. 2 of the Cell Shield RTQ 3 times a day with food. That only leaves us with the Beyond Tangy Tangerine, which is always the sticking point here. The Beyond Tangy Tangerine is a sticking point because it is, in fact, going to be hard for his body to absorb this. So here's how I would do it.
Okay.
I would put 1/2 of a scoop
Okay.
in 1 liter of water.
Okay.
1/2 of a scoop in 1 liter of water. And I would deliver that into the feeding tube, every 5-10 minutes, couple of ounces of it every 5 to 10 minutes. Just do that for 3 days. Look to see how the Foley bag looks and if everything's okay. And if everything's okay, on day 4, do the same thing in the afternoon. The same thing in the afternoon. Make another one of those cocktails and deliver it to him the same way. Do that for 3 days, and then holy smokes, we're out of time. You stick around, Maria. I'm going to finish this up. Let's talk to Maria from California and finish it up. I'm spending so much time with Maria. I don't normally do this because she has been on hold for 2 days. 2 days in a row. She sat through 2 of my radio shows, patiently waiting for me to take her call, and we were only able to get to her call at the end of yesterday as we were closing up. So that's why I'm kind of going above and beyond the call of duty here for Maria, because quite frankly, she deserves it. So, all right, Maria. So the trickiest thing here is going to be getting the Beyond Tangy Tangerine into your dad, because his system is just shot, man. I mean, it's shot. So you're going to have to mess around with the dilution of this, but do it the way that I just recommended for 6 days. And if the Foley bag looks good, if it's not like fluorescent yellow, glow in the dark, or like super red, you can see the beet powder coming out in the pee. If it kind of looks like everything's okay, then you can up the ante. So you would use the same amount of liquid, but you would double the amount of Beyond Tangy that you're putting in the liquid, and you would deliver it to him in the same kind of slow drip fashion, right?
Okay. Now
that's going to be a pain in the neck to do that, by the way.
That's okay. 1 liter drip is going to be about. Normally, I give him, because of the hyponatremia, I was told to not give him too much free water. I was only supposed to give him from maybe 1 liter to 1.5 liters a day.
Well, that's just nuts. I mean, hyponatremia. For goodness sake, why don't you just put salt in the Foley? Why don't you put salt in it?
I would put salt in the food. I remembered, and something so simple I kept forgetting. So put salt in everything you give him. Put salt, because he's not going to taste it. Right? So I would put a level teaspoon of sea salt or Celtic salt or Himalayan salt in every liquid that you give him, and that will eliminate the hyponatremia. That's not rocket science, right? So
salt. Load him up on salt. His body needs salt. His body craves salt. His body, and if he's hyponatremic, then that's kind of the easiest way to do that. Because the only way that you're going to be able to get this stuff into his body in a way which, hopefully he'll be able to absorb is if it's diluted and given to him slowly over time. So there's no harm and no foul there. And oftentimes one of the things that will cause kidneys to shut down is dehydration. So,
this liter I'm going to begin with a half scoop into 1 liter. Can I give him this liter actually over the whole 12 hours, or does it have to be in the morning within an hour?
No. For the first 3 days, I want you to give it to him over the whole day.
Okay, over the whole day.
And then on the next day, or on day 4, I want you to do that twice. I want you to give him 1 liter in the morning, 1 liter in the afternoon.
Okay.
That's what I would do. And then if that's okay for 3 days, on day 7, I would double the amount of Beyond Tangy Tangerine that you put into each liter bottle.
Okay. So it would be 1 full scoop.
Yeah, right. So, but you got to work up to that. And whether or not he's able to metabolize that, I don't know. Now, the final nail in the coffin here, because of the history of antibiotic use and bladder, funkiness, would be some type of probiotic. Have you given him any of that at all?
I started with the enzymes last week, but
yeah. Well, you need a probiotic.
Every morning for the last 9 years, he's been on kefir.
Yeah, kefir. Yeah.
Kefir. Okay, he's been on that every single morning. His breakfast, the base of it is kefir.
All right, well, that's great, and I don't have any problem with that. But look, after the administration of an antibiotic, kefir or yogurt or sauerkraut just isn't going to cut it. So for 14 days, the recommendation would be in each of his, between meals, when you give him the, the minerals and the selenium, I would do 2 of Youngevity's Flora FX, 2 of Youngevity's Flora FX. And you can open those up and just dump them in the solution and put it in the feeding tube. 2 of those twice a day between meals. I would stop that after 14 days because he shouldn't need it anymore.
Okay.
Well, that's a good plan. I mean, that's a good place to start with. And always remember that there's a little secret that, only the initiated know, that you can give to people who are bedridden and who have digestive troubles like this. You can spray the plant-derived minerals right onto their skin. You can just spray the plant-derived minerals onto the skin. It works best if it's the skin around the abdomen, and they will absorb through the skin and get into the bloodstream that way. So that's another workaround for that. We had a nice recovery last week of a child. She was in her 20s, and I forget the diagnosis. I don't know. I don't think the child was autistic. I can't really remember. Oh, she had lots and lots of seizures. It was a lot of seizure activity. And the seizures had wiped the kid out. She didn't want to eat. She didn't want to drink. She was kind of huddled up, on her bed, kind of non-responsive. And the parents were thinking, holy smokes, we're going to have to take her to the ER and they can give her IV fluids, because she doesn't even want to drink anything. Well, they sprayed the plant-derived minerals on her abdomen, and within 24 hours, the kid's eating and drinking like a normal person. So that's always an option, not to be overlooked. But I think the feeding tube is actually going to be your best friend here. You just have to figure out the dosage schedule and, play around with it. You sound like a smart woman, Maria. I think you can figure it out.
Dr. Glidden, I've heard in more than one source that because I think I told you it was hypothyroid.
Yeah.
That hypothyroidism or patients with should not take in cruciferous vegetables and peaches and pears.
Well, I don't know about the peaches and pears. That would be new to me, but an underactive thyroid would be exaggerated by cruciferous vegetables because they downregulate thyroid function for sure.
Well, that's why I've heard to also be true of peaches and pears. Now, the Beyond Tangy Tangerine, which is supposed to be a peach.
Well, look, that's news to me. I've been doing this for 25 years. I've never heard that, and quite frankly, I don't believe it. So I'm not going to tell you to worry about that whatsoever. And quite frankly, his thyroid function right now is the least of your worries. But remember, this is a holistic strategy. So as we feed the body the stuff that it needs in a holistic manner, all 90 essential nutrients, eliminate the 10 bad foods, give a little extra digestive support, then we anticipate this program to have positive ripple effects across the board. Help his heart, help his lungs, help his thyroid, help his kidneys, help his adrenals, help everything, because that's what we do here. We don't separate the pieces in a reductionistic, fractionated fashion like the MDs do. We give the body everything it needs all of the time, keep our fingers crossed, and get out of the way. Now, cruciferous vegetables, that's academic, that's unarguable. I don't know about the peach thing. I've never heard that before, and quite frankly, you'd have to really show me some evidence to make me lean that way.
Well, I'll trust you on that, so I won't worry about the peach or the bean inside the BTT. Does Z-Radical play a role in this?
No, I wouldn't do that. I mean, we don't want to scrub the pot so hard that we break it. And by breaking it, I mean, we don't want to give a weak digestive or fragile digestive tract so many nutritional supplements that it's going to cause, a reaction, right?
Okay.
So we just start slowly for the next 3 weeks, man. Just go slowly, and then you see how he responds. Maybe 2 months from now, you can throw in some Z-Radical, no problem. But right now, I'd hold off on anything extracurricular.
Okay. All right, then I'll follow this to a T.
All right, Maria, you are awesome. If every father in the world had a daughter like you, there would be so much less pain and suffering. No kidding. I know everything about that. You are awesome. Keep up the good work. These are the types of people that are attracted to longevity, ladies and gentlemen. People who are compassionate, people who are caring, people who think about the health of others as much, if not more, as they think about their own health. This is a good group of people to hang out with. This is a good group of people to break gluten-free bread with. You interested? You should be. If you want to find out more about longevity, then please pay attention to the commercial breaks if you're listening on a terrestrial radio station, because your radio station will give out a phone number that you can call to speak to a representative in your area who can tell you everything you need to know about longevity. There's 2 ways you can work with longevity. You can work with longevity as a customer. You have access to the world's best, most effective, clinically verified, science-based medical therapeutics that currently exist on the planet. Or you can join Longevity as a business builder, and Longevity will pay you to help them spread Dr. Wallach's message of health recovery through science-based, clinically verified medical nutrition, and we need your help. Because everybody on planet Earth is sick and suffering, and everybody is sick and suffering because nobody knows anything about science-based, clinically verified, fundamental medical nutrition. We cleaned up the water supply and educated people about that, and all of a sudden, people started living longer. We told people not to pee upstream and drink downstream, and all of a sudden, people started living longer. We told people to eat 3 square meals a day, and all of a sudden people started living longer. Well, when we tell people about the simple solutions, the simple facts of medical nutrition, 90 essential nutrients, the necessity for 90 essential nutrients every day, and look, here's 10 foods that nobody should even look at, let alone eat. When we combine those 2 things together in a generic for the masses program, we're going to change lives. You've heard the testimonials here. You think we're making this stuff up? By the way, I don't screen calls. We're not a high-tech, multi-million-dollar operation yet. We don't screen calls. Calls come in, I take them one at a time. I take them as they show up on the board. Most of the time, I have no idea what these people are going to talk to me about. No idea whatsoever. And people call me, and they tell me what happened to them. Once they've gotten on board with science-based, clinically verified medical nutrition, it'll make you bring a tear to your eye. If these testimonials don't bring a tear to your eye, you're not human. And also, if they don't fill you with righteous indignation, there's also something wrong, because quite frankly, you've been played. You're not sick because you're a human being. You don't have a bad kidney because you have a kidney. You don't have asthma because you have a lung. You don't have arthritis in your knees because you have a knee. And you don't have a bad gene, for goodness sake. If you're dealing with a chronic health condition, you are nutritionally deficient. Your body has simply run out of the stuff it needs to maintain that part of the body. It's not rocket science. But because your MD, who is the king of the hill in medicine in North America, in the European Union, in New Zealand, in Australia, has no training, no experience, no respect, and no appreciation for medical nutrition, you're not going to get any advice or perspective on medical nutrition from conventional medicine. So most people think, well, medical nutrition, must not be that great because my MD didn't tell me about it, which is kind of thinking, well, funding for the military isn't that great because my Democrat didn't tell me about it, or funding for, school lunch programs can't be that great because my Republican didn't tell me about it, or whatever. It's an ideological thing, not an academic, scientific thing. Your medical doctor is the last person you want to listen to when it comes to a chronic health condition, and they're the first person you want to listen to if you have a broken bone or a bleeding to death. You need perspective. Perspective makes everything clear and paves the way for knowledge, and knowledge will lift you up. Stick around. Much more to come. Let's see if Kate in Manchester likes free. Hey, Kate, thanks for the call. Are we talking Manchester, England?
No, Manchester, New Hampshire.
Cow Hampshire. How's Mount Monadnock this time of the year?
Oh, it's all very colorful.
One of the coldest days of my life was spent New Year's Eve. I think it was 2001. At the University of New Hampshire's ice skating rink. We went to see a Disney on Ice production, and when it got out, it was like 20 million degrees below zero. It was the coldest I've ever been in my life.
Oh, so you've been to the Durham campus?
Oh, yeah. Yeah. I grew up in Massachusetts, and I went to college in Massachusetts. I know New England like the back of my hand. When was the last time you were on the Kankamangas Highway?
Oh, the summer I worked with children with behavioral issues.
Yeah, it's one of the most beautiful roads in the United States, as far as I'm concerned. It's beautiful.
New England's a very beautiful area. I'm actually a native New Englander. I was born and raised in New England.
You got to love it, Kate. So, look, in the interest of time, how can I help? Thanks for calling.
Yesterday I had an incident at my job where I had some pretty severe abdominal pain, and it was pretty bad. And also, I also had an issue where I dry heaved and my blood pressure got so low that I passed out.
I hate it when that happens.
I actually passed out, and I had to go to the hospital last night.
Okay. So what did they figure out? Did they tell you what happened?
No, they didn't. They basically reiterated a symptom.
Isn't that great? Yeah. Oh, yeah. Well, you have a pain in your elbow. Thanks a lot, Doc. I knew that when I came in here. Yeah. You're welcome. That'll be $5,000, right?
That's kind of why I went to the ER, was because I kind of needed medical attention, because we had cause they were talking crazy things like ovarian torsions and ovarian cysts, and I'm like, okay, and they couldn't find anything to prove that, and then they're sitting there telling me that potential STD. I'm like, what?
So it must be an STD. If it's nothing else, it's got to be an STD. Yeah, that's great.
Well, the thing of it is that I'm married.
Yeah,
so
crazy.
That would assume that my husband was cheating on me, but he's not.
Well, look, they're just throwing crap on the wall, hoping that it sticks.
Yeah.
Because they don't know what they don't know, and that's it's a tragedy of biblical proportions here. I mean, no kidding. These people are just nuts. Has this ever happened to you before?
Yes, actually it has. It happened twice to me 3 years ago.
And at that point in time, was anybody able to get to the bottom of it?
They said it was septicemia.
Septicemia?
Yes, I went into septic shock.
From what?
A very, very severe colon blockage.
So, holy moly macaroni. Okay, so are you on board with Youngevity at all? Are you doing any of the Youngevity stuff so far?
Yes, I am doing the Youngevity stuff, and I have, I actually have plant-derived minerals. I have the Ultimate Classic, Ultimate EFA, Selenium.
Have you eliminated the 10 bad foods?
Yeah, I've eliminated the 10 bad foods, and I don't understand what the heck happened. All I had yesterday was eggs.
I don't understand what happened either. Now, look, we're coming up against a hard break here. I'm going to pull you up when we come back at 6 after the hour. I'm going to try to sort this out with you. Can you hang out with me for that long?
Unfortunately, I have class at 5.
All right, kiddo. Well, you have to call me back tomorrow because we are out of time and I really want to help you. So give me a shout back and I will look forward to it. Hour 2 coming up, ladies and gentlemen, at 6 after the hour. Batman looked a little out of focus there. We're going to start off this next hour with my monologue, which I was not able to do in the first hour. I'm going to be reading excerpts, say that 10 times fast, from Saying No to Vaccines, a resource guide for all ages by Dr. Sherry Tenpenny. This book should be on the shelves of everybody in the world. Saying No to Vaccines, a resource guide for all ages by Dr. Sherry Tenpenny. This from page 30. Moving on forwards. The global smallpox vaccination program is not nearly as successful as it is touted to be. If the science of vaccination worked, it should have completely prevented epidemics. But instead, while the population of England increased 16% during the years of compulsory vaccination, smallpox deaths increased 160%. A figure that does not include the deaths from the vaccination itself. The only complete series of official records in Europe revealed that the decrease in smallpox mortality paralleled the decreased use of the vaccination, which means less people died the less they were given the vaccines. Moreover, some of the most severe epidemics on the continent occurred after the onset of compulsory vaccination. Vaccinations are not what they are touted to be, and it's not a belief, it's not speculation, it's not a theory, it's an academic fact. And the fact that your medical doctor overlooks this stuff, quite frankly, is criminal in my behavior. In a report published in an early edition of the British Medical Journal, Dr. L. Parry analyzed vaccination statistics and asked the following questions. How is it that smallpox is 5 times as likely to be fatal in the vaccinated population as in the unvaccinated? How is it that in some of our highest vaccinated towns, Bombay and Calcutta, smallpox is rife, whilst in some of our poorest vaccinated towns, such as Leicester, I know I butchered that, Leicester, it's almost unknown? How is it that something like 80% of the cases admitted into the Metropolitan Asylums Board smallpox hospitals have been vaccinated, whilst only 20% have not been vaccinated? You would think it would be the other way around. That from the British Medical Journal, by the way. By 1897, a weaker form of smallpox, variola minor, became the dominant strain in the U.S. Although the rash was similar to classic smallpox, the new form was a mild disease, left little scarring, and only rarely caused death. The illness was considered an inconvenience more than a danger, especially compared to the risks of serious harm from vaccination, which included infection, gangrene, and even tetanus or syphilis. Imagine that. Nevertheless, pro-vaccination publications issued by health departments often used gruesome photos of the worst cases of variola to generate fear. This coercion technique allowed vaccination to continue in the U.S. until 1971. Even though the last reported case of smallpox was in Texas in 1949. Here's a myth that's promulgated by the medical industry quite frequently. And by the way, this is a preamble to tomorrow night's webinar for Dr. Glidden insiders and their guests exclusively. Vaccination Part 2. Tomorrow night, 8 p.m. Central Time, for Dr. Glidden insiders and their guests exclusively. Vaccine-induced antibodies provide protection against infection, disability, and death caused by vaccine-preventable diseases. Antibodies are a sign of protection. This is a myth. The role of vaccine-induced antibodies in disease prevention is unclear. A new vaccine is developed with the intent of stimulating the immune system to produce a protective antibody. Physicians believe that the presence of an antibody is proof of immunity and protection from the illness. However, even the medical journal Vaccine reported in 2001, I quote, it is known that in many instances, antigen-specific antibody titers do not correlate with protection. Do not correlate with protection. That from the journal Vaccine. Many who have been vaccinated and developed antibodies contract the disease, and those who do not develop post-vaccination antibodies do not become ill. Is it the presence of an antibody that defines the state of the person's resistance to an infectious disease? Well, your medical doctor will say yes. And that's how they judge the efficacy of any type of a vaccine, by giving somebody the vaccination and then waiting a certain number of weeks, drawing their blood again and seeing if the antibodies to whatever they vaccinated you against have increased. The belief here is that the more antibodies you have in the blood, the better protected you are, but the scientific literature does not support that fact. It's kind of like medical doctors believing that heartburn is caused by too much stomach acid. It's not. Kind of like medical doctors believing that type 2 diabetes is genetic. It's not. Kind of like medical doctors believing that congestive heart failure is, genetic. It's not. Medical doctors get it wrong all of the time, and you continue to give them your hard-earned money in the form of medical insurance premiums. You need to stop it. You need to snap out of it. You need to get a clue. Next time you go to the restaurant, have the waitress bring you a clue. Here's some references from the literature regarding the this whole notion that antibody titers, the presence of antibodies in the blood, has anything to do with immunity. Pertussis continues to cause significant death and mortality in infants and children throughout the world, even in well-immunized populations. Laboratory measurements of antibodies have not demonstrated a level that corresponds to protection. That from the Clinical Diagnosis Laboratory Journal Immunology, 1999. Determining the correlation between the level of antibodies in the blood and immunity to pertussis has been difficult. It is unlikely that the association can be ascertained. There is no direct association between antibody levels that ensures protection from pertussis. This from the journal Infectious Immunology. Again, there is no known direct correlation between levels of specific pertussis antibodies and protection against pertussis. That from the Canada Communicable Diseases Report issued in 1997. How about mumps? Little is known about the correlation of mump titers and protection from mumps. That from the Journal of Clinical Microbiology, 2005. Pneumococcus. The results from several randomized studies show that the polysaccharide pneumococcal vaccine does not appear to reduce the incidence of pneumonia or death in adults with or without chronic lung disease or in adults who have other chronic illnesses. Neither does the vaccine reduce the incidence of pneumonia or death in persons 55 years and older. That from the Cochrane Library, issue 4, 2003. Seasonal influenza. You got a seatbelt, you want to fasten it. A serum antibody titer of 1 to 40 does not guarantee protection from influenza infection. People with lower titers show protection against influenza, and people with higher titers can have symptomatic infections. Moreover, the assumption that a titer value of 1 to 40 or greater will protect an individual from infection is valid only if the virus causing the increased titer is exactly the same that is in circulation during the flu season, and it never, ever is. The vaccine that is rolled out this year was based on influenza viruses that were obtained a couple of years ago in China. It is not relevant to the circulating virus which is present in the world in any given flu season. They don't have the technology to keep up with that. Well, maybe they do, and they're just not doing it. It's just really, really crazy. It goes on. The last thing I want to read here. Here's another myth. Vaccine-preventable diseases of childhood can be serious. If your child is not vaccinated, your child could contract one of these illnesses and die. This is a myth. This is a typical example of fear-mongering tactics used to coerce patients into vaccinating. Certainly, childhood illnesses can be serious in some children. However, the vast majority of children who contract a vaccine-preventable disease, quote unquote, experiences a week or two of discomfort, fever, vomiting, and a rash. They pass through the childhood illness and recover uneventfully. While rare complications can occur in any child, the underlying health of a child who experienced the complication is unknown. For example, was the child immunocompromised by drugs such as steroids? Was the complication associated with other illnesses such as congenital heart disease or cancer? Data generated from the Center for Disease Control documents that the mortality rate from pediatric infectious diseases declined to low levels before vaccinations. Before vaccinations were present. You have been fed a boatload of crap by the pharmaceutical industry. Now look, we are not against, things just because the pharmaceutical industry rolls them out. We're against inaccurate, fuzzy, inarticulate, bad science delivered to you at a profit. That's what we're against. Every time I go to the dentist, I thank God for Novocaine. Love that drug. Love that drug. Thank God for penicillin, sometimes. Thank God for morphine, right? Thank God for the sterile technique. Love that stuff. It's really great stuff. It's not the drug, it's how it's used. When MDs use vaccines, they use them willy-nilly, and they are not paying attention to the published literature because they are intellectual cowards. They do not want to step outside of their comfort zone, and they'd rather just do what their colleagues have always done, just stay inside the fold. It's a herd mentality, rather than actually pick up a book and do some learning. I mean, all of the stuff that I talked about here, and there is so much more, was published in mainstream vaccination medical journals. It wasn't as if they had to hunt and peck for this stuff. It's right in front of their face. But, when it goes against their conventional wisdom, they ignore it. Let's go to Bonnie in Wisconsin and see what she has to say. Hey, Bonnie, thanks for the call. You are live.
Oh, thank you, Dr. Glidden, for taking my call. This is to update you. This is about the urinary tract infection.
Okay.
With the bleeding, The reason I was calling is you told me to call you back, and I've been taking the supplement program that you told me to take. 1 EFA 3 times a day with meals, 1 ounce of VTT morning and afternoon, 30 ounces of water. The OsteoFX, 1 ounce morning and afternoon, and 2 ounces at night. The burning, of course, is gone. I told you that last time. But there's still some bleeding, and today it's like a light to clear, but it does get light to medium. Now, I'm over my menstruation cycle. I haven't done it in a long time. So I'm wondering why this bleeding is going on. Part of the infection, I don't know. I also get cramping in my lower abdomen. Now, I to comfort myself, I sometimes lay on the heating pad, or I kind of rock back and forth a little bit,
Yeah.
They're like menstruation cramps, but I've never had cramps like this. They were just a little bit, and then I got it, and I was over it.
All right. Well, the most
stronger.
Okay, so the most common cause of this, and a little bit of extracurricular blood where there shouldn't be, are both lacks of calcium and magnesium, with the lion's share of being calcium here. So my recommendation to you, given this set of symptoms, would be simply for 5 days, double up on the amount of calcium that you're taking, and see if the cramping doesn't go away, and see if the urine doesn't clear from the blood. That's what I would do if I were you. How much liquid calcium are you taking right now?
What you recommended: 1 ounce morning, 1 ounce afternoon, and 2 ounces at night.
Okay.
And I've been sleeping at night, which I thought that's good. But also, I need to tell you, yesterday, I ate breakfast, which was like a half a pancake, which is gluten-free with butter. And then I started sipping on the BTT a little bit, maybe 20 minutes after, and I threw it all up.
Oh, you threw it up?
Threw it all up.
That's
and last week I did it once. But like I say, it's not every day. But when the cramping comes, it's like it comes after I eat, maybe. And it's just, like yesterday, I was laying on the bed all day, just kind of rocking myself back and forth and kind of laying on a heating pad for a while, and then.
Yeah, well, something's going on here that's not, that's not right. Do you have a chiropractor that you can work with, a chiropractor that you know, or that you have any type of relationship with where you live?
Not right now. I don't know of any.
Well, you need to have.
Find one.
Yeah, I would find one, because you need to have somebody poke around your abdomen and, give you a sense of what's going on here. This could be any number of different things, but when we see strong and persistent symptoms like this, and then, you're throwing up into the bargain, then there's something going on in the gut, which is not good.
Now,
what I would do. Go ahead.
Okay. I've also experienced some burping and a little gas, which I don't usually do. But it's I think it may be from the product. I'm not sure.
Yeah, most probably is. So here's what I would do. I would continue to take everything, but I would stop the Beyond Tangy Tangerine for 3 days.
Okay.
Stop the Beyond Tangy Tangerine completely for 3 days. See what happens to all of these symptoms. And for goodness sake, I would have a medical professional who's not an MD poke around your abdomen and see whether or not they can give you any diagnostic clues as to what's going on. If you can find a chiropractor who is trained in applied kinesiology, K-I-N-I-E-S-O-L-O-G-Y, I think, applied kinesiology, they are always your best bet, in my opinion. That's what I would do. Give it a shot and call me back with a report. I always look forward to that. Debbie from Missouri is up next, folks. Kate from Manchester's skipping class to call me back. I gotta love that type of behavior. Hey, Kate, thanks for the call back. You are live.
Hi, Dr. Glidden.
All right.
My class got canceled.
All right. See that? Yeah. That's because the professor was probably, eating gluten for lunch and had an attack, and now they've rushed him to the hospital and they're going to bankrupt him. So, I'm glad you found your way back.
Yeah, it was just, we had it. Yeah, this had happened to me 3 years ago. My husband was going into the military at this point, and we had just gotten married, and my boss found me on the floor.
Yeah, that's a great little job introduction, right?
Yeah, it's crazy, and 3 years ago they're like, it's gastritis. Okay, well, what's causing that? So they're just they gave me Pepcid to ease, to stop the bleeding in my stomach.
Yeah, so this is nuts, right? So gastritis, that's just fancy schmancy doctor talk for inflammation in the abdomen. You knew you had inflammation in the abdomen when you went in.
Yeah,
right?
That's why I was screaming in horrific pain.
Yeah. So it's just crazy. So here's what I would recommend that you do, because there's a number of things that can cause this, and we need to dial in what that is as accurately as we can, and the MDs are just going to be useless here. However, you live in a college town, right?
I actually live in the south end of Ware, but I go to school in Manchester. I'm actually at...
Okay, then it's going to be easier than eating a piece of apple pie for you to find a chiropractor trained and licensed in applied kinesiology.
I have a chiropractor.
Oh, I'm not sure that he does kinesiology, though.
Yeah, I'm not really sure if she does that either.
Okay, so I'm telling you, you need to find a chiropractor who's trained in applied kinesiology, because an applied kinesiologist who's good at what they do will be able to diagnose this for you relatively easily, and they'll be able to tell you, whether it's a mild, moderate, or serious condition, whether it was caused by a nutritional supplement overdose or caused by a voodoo curse. I mean, who knows? It could be a lot of different things here, but when you have a strong and persistent symptom like that, you need to get to the bottom of it. I will tell you off the cuff that a couple of things that cause people to pass out like that spontaneously are dehydration and too much coffee. Dehydration and too much coffee. So if you wake up in the morning and you're late for something, you're late for work, you're late for school, you're late for your spaceship ride to planet Mars, and you skip breakfast and you have a great big, 16-ounce cup of coffee, and you drink it all down in a half an hour, and then you don't have any water for a couple hours, you can pass out. Because the combination of those two things, no food in the stomach and too much coffee and dehydration, can make you pass out. So that's a common thing that causes that. There are some herbs that can cause that. Youngevity has a product called Cell Shield RTQ that if you take too much of that on an empty stomach with coffee, you're going to pass out. But notwithstanding that, and especially because you have a history of this stuff, Kate, you need to go to a competent physician who has the tools to be able to diagnose this. And I'm telling you, a chiropractor who is trained and certified in applied kinesiology is the person for the job now. So I want you to go to my website, drglidden.com, and right there on the front page, you don't have to log in, you don't have to be an insider, you don't have to do anything. Under the date on the front page of my website, there's a little search box, and I want you to type in Dr. Matt, M-A-T-T-P-E-A-H-L, Dr. Matt Peal, P-E-A-H-L. And that will then hit the search button or the submit button or whatever it is. And it will immediately bring up to you on that page the radio show that I did where I interviewed Dr. Matt Peal, who is a specialist in applied kinesiology. And if you listen to my interview with him, you'll get a better sense of what applied kinesiology is. And we also talk about a couple of websites that you can go to do a search for chiropractors that have been trained in this methodology. And I believe you need to get this diagnosed, toot sweet. And, since the MDs have their heads up.
I agree with you.
Yeah,
I actually have a 14-month-old daughter.
Okay, did you name her Dr. Glidden by any stretch of the imagination? Because that's a really good name.
Elizabeth. No, her name is Elizabeth Lucia.
Well, look, here's what you can do. You can go to the town hall and you can get the name change form, and you can just change your name to Dr. Glidden, and I'll be okay with that. I mean, I'm perfectly fine with that, no problem.
Yeah,
so listen, you need to dial this in, okay? So go to the website, Dr. Matt Peal. It'll bring up the radio show that I talked about applied kinesiology with him. Watch that segment. It's free. And then find a chiropractor who's versed in that methodology. And once they tell you what the cause is, call me back, and I'll tell you what to do next. Sound good, Robin Hood?
That sounds good to me.
All right, Kate, go out there and get your health back, and give me a call back once you've dialed it in. Missouri is up next. Let's go and talk to Debbie and see what's going on with her. Hey, Debbie, thanks for the phone call. You are live.
Dr. Glidden, thank you for all you've done because I've learned so much from you.
You're welcome.
Anywho, speaking about the vaccines.
Oh, no. Wait a minute. You know, Christmas is coming up.
Yeah.
So, you know, Christmas is coming up.
Okay. Well, I'll get you something real nice.
You know, I like to play golf. Did you know that? I love to play golf.
Oh,
Did you know
no, I didn't know that. So maybe some balls for Christmas? Okay. Anywho, vaccines. I had all the childhood diseases, and I was fine. So this vaccine thing is a bunch of, whatever.
Yeah, I know.
Anyway,
And see, this is the thing. When you've been through a normal childhood illness, and you then your immune system is strengthened, and you're in a much better situation than you are if you got vaccinated for whatever it is they were trying to vaccinate you against. It's just a gigantic scam that has no science, or it has some scientific basis, but it's really just fuzzy, old-fashioned, outdated thinking. But the MDs are never going to change their tune because they're intellectual cowards, and we're suffering because of it.
No, I've been a practicing nurse for 25 years, so I know they're a bunch of dummies.
Well, there you go. And honest to God, if I was elected king of the world, the first thing that I would do is I would put the nurses in charge of the doctors. I would.
Yeah.
And then everything would change. No kidding.
Yeah, me too. Anywho, the reason why I'm calling, I keep saying anywho like an idiot, I have high blood pressure, and I'll give you the list of things that I'm taking. I take a tangy tangerine, 2 scoops in the morning and at night, 9 EFAs. I take 6 ounces of calcium a day, either the OsteoFX or the Cal Toddy. I mix it up. I take enzymes before or after meals. I take Ultimate Daily Tabs, 9 a day, Selenium, 8 a day, Sweeties, 8 a day, sometimes up to 15. I fixed my diabetes. I was having a fasting blood sugar of 300. Now it's 140, so that's okay. I don't do the 10 bad foods, and I still have high blood pressure and have to take 8 or 10 blood pressure pills a day just to get it to 140 over 8.
Okay, so how long have you been doing longevity?
7 months.
And how long did it take the blood sugar issue to resolve?
6 months.
All right. And how long have you been diagnosed with high blood pressure?
10 years, 15.
Okay, so it's going to take probably 12 months. And this is... this is totally by the. I'm going by the seat of my pants here. The old-time naturopath said that it takes approximately 1 month for every year that you've had the problem to get on the other side of it. You've had this for 15 years, so that's 15 months. But longevity will speed that up. So I'm going to guess you're just going to need to maintain the discipline here for a little while longer, and then all of the chickens are going to come home to roost. And what will happen, I will tell you what will happen eventually, because we see this all of the time. And it also makes sense, right? I mean, these things have to make sense because we are hanging out in the scientific zone. I mean, that's what naturopathic medicine is all about, marrying the scientific method with non-drug therapeutics. So what happens is, your body's been just tricked out, man. It's been hurt. It's been harmed. It's been hanging on by a thread for the last, 50 years, right? Because you've been eating all the wrong foods. Your body's been completely undernutrified. Now you had to deal with all these medications on top of it. Plus, the stress of life never lets up. So it's like you're walking through a winter snowstorm with a bathing suit on, for goodness sake. You're just not prepared to handle the stress of life because you're doing all the wrong things because you took the wrong dog to the hunt medically, right? So as you get a clue and you adjust your diet and you get on board with the nutritional supplements, things start to come around. And, the blood sugar's gone. I mean, the blood sugar issue's gone. That's huge. It's a huge thing. So now we expect something else to change and then something else to change and then the blood pressure to go away. And what's going to happen is one of these days, might be tomorrow, might be 6 months from now. I don't know. You're going to wake up and it's going to be like somebody flipped a switch and all of a sudden your blood pressure numbers are going to start to come down into the normal zone. And it's going to happen It's going to happen quickly. It's going to appear to have happened quickly. It's going to be, like the buildup of all of this stuff over all of these years, and your body's kind of getting it back together one molecule at a time, right? And then all of a sudden, the plane takes off, and it's 3,000 feet in the air in 10 seconds. And so you just need to maintain the discipline here and lean on your experience to date to give you inspiration to maintain the discipline. And you are in the hardest category of people to help with medical nutrition, because you're in this weird gray zone between dramatic improvements and, future improvements, right? So this is just this is the way that medical nutrition is. It might help you to go to the gardening center and buy a little tomato seed and put it in one of those little tiny pots, and keep it in your kitchen. And just as the tomato grows, kind of use that as your yardstick for improvement. And by the time there's a nice, healthy, robust tomato on that vine, you should expect your blood pressure to be much better than it is now. That might give you kind of a visual cue to maintain the discipline over time, which is what you need to do.
Okay.
Does that make sense?
I have faith. I believe in it totally.
That's great. And we need, we need faith and we need belief, but we also need that to be grounded on results, right?
Mm-hmm. Yeah.
Which you already have. And so moving forward, you just need more time, Debbie. That's all.
So you think I'm taking the right products? I mean, these are okay?
Yeah, absolutely.
Okay.
And you're not getting any negative side effects, right? No diarrhea. No, you haven't grown an 11th finger or anything like that, right?
Well, I mean, I had some loose stools, but that's gotten better.
Yeah, so you're good to go. No, man, just the only thing you could do is just make sure there's no hidden gluten in anything that you're eating, right? As long as that's taken care of, you're good to go, man. Just give it a little more time. Trust me, give it a little more time, and you're going to love how you feel. Derek in Indianapolis is up next. We're going to talk about X-rays. Welcome back, everybody. Dr. Peter Glidden here, your steadfast advocate for health, bringing today's show to a close. We're going to go up to Indianapolis and talk to Derek about X-rays, I think. Hey, Derek, thanks for the call. You are live.
All right. Good to hear from you, sir. And he doesn't screen his calls because he let me in.
What's going on?
Well, I just had 3 questions if you could touch on them, because sometimes people aren't brave enough to call in, so we have to do it for them. I was wondering about when you go to the dentist and you have insurance, quote unquote, and they always want you to, like twice a year or so, get an X-ray on your teeth. And I'm like, well, my teeth are fine and everything's fine. Why do we have to get these X-rays? Because I hear Dr. Wallach talking about ultrasounds versus always getting an X-ray. And the second thing is, why do men get enlarged prostates? I know we have that product, Prostate FX, but I was just wondering, what is it that causes that? And then, for people to get enlarged prostates and then maybe later on prostate cancer. And then the third question would be, if someone already had a kidney transplant, they're a little nervous on trying the product, what would you tell them? Those 3 questions.
Okay, so we'll go backwards. So the kidney transplant, they shouldn't be nervous. They should be excited, because the reason that they got the kidney transplant in the first place was because they had a funky kidney. Why did they have a funky kidney? Now, sometimes it's, you had a knife wound or a bullet in your kidney or shrapnel, or in an automobile accident, your kidney was smashed to smithereens. But most of the time, people have their kidneys removed because their kidney was funky because of metabolic reasons. And, you don't get a bad kidney because you have a kidney. You get a bad kidney because your body doesn't have the right nutrition. So surgically removing the kidney and putting in somebody else's kidney is not going to fix the problem. and it's only a matter of time until the fake kidney gets bad, just like the original kidney did. So the surgical procedure does nothing to fix the cause of the problem in the first place. It's like painting over the mold. Well, in this case, it would be like putting a new piece of drywall over the mold rot without fixing the water intrusion into the basement. It's only a matter of time until the new drywall gets bad also. So medical nutrition attempts to address the fundamental cause of kidney pathology, number one. Number two, whenever anybody is on an anti-rejection medication, which they are when they have an organ transplant, the anti-rejection medications will work better and more effectively and more efficiently if they are doing medical nutrition. The vitamins, minerals, and nutritional supplements will help their meds to work better. They will have a better response from their treatment when they're on medical nutrition. Nobody knows what causes prostate cancer. This is a big problem. Nobody knows what causes any type of cancer. We've spent $1 trillion on cancer, and all that your oncologist can tell you is, oh, it's genes, it's genetic, which is kind of like saying, well, you know, sunlight causes cancer because without sunlight there wouldn't be life, and without life there wouldn't be cancer. Well, thanks a lot. It's a dodge. So nobody knows what causes prostate cancer. There are a number of, presumptions. So what we do when we are attempting to interface with people's health is we recommend that they stop eating food that's going to hurt the body, because if you eat wrong food all of the time, it's going to generate chronic levels of inflammation, low levels of inflammation in the body. That's not a good thing. And then the body's going to break at its weakest point. One of the nutrients necessary for healthy prostate function is selenium, the trace mineral selenium. So whenever we see somebody up against the wall with a prostate condition, in order to help support prostate health, we recommend that they take more selenium. And as far as x-rays are concerned, it's a really complicated situation. The general recommendation for exposure to x-rays is not to exceed a qualification called a REM, 5 REMs a year, R-E-M, 5 REMs a year, or RAD, sometimes it's called a RAD, 5 RADs a year. But quite frankly, medical doctors who give you x-rays all of the time are playing with your health. And if they weren't bad for you, then why do they scurry out of the room when they turn the switch on? I recommend as few x-rays as is possible, but in the literature right now, the recommendation is nobody should have more x-rays per year than gives them 5 RADs or 5 REMs a year. It's kind of a complicated subject. I should probably do an entire webinar on it. I appreciate your trust and your commitment to the cause. Ladies and gentlemen, God willing and the creek don't rise, I'll see you tomorrow. Live long and prosper.